everyone. Welcome to my show. Autumn is here. This is Francine Crawford. And today we have a special guest, Dr. Carrie Giuliano. She's going to tell us about some things about that we should know about keeping our dental hygiene up. Welcome to our show, Dr. Giuliano.
Oh, thank you for having me.
Thank you for coming. So first, let's tell me a little bit about yourself.
Okay. So I grew up in Brooklyn, New York. I went to dental school up in Buffalo, and I graduated in 2003. I've been practicing in New York City for the past 20 years. So I have a private practice in Gramercy, and we see patients of all ages from 2 up until 90. So.
Okay. Awesome. Well, Autumn is here is about just things that we should prepare for as we're growing older, seniors, and for our parents to look out for. So dental hygiene is very important. So I wanted to make sure that people understood, what things to look for and things like that. So tell me about the importance of dental hygiene, especially as you grow older.
So dental hygiene is important, obviously, at any age, but even when you're getting older, sometimes dexterity is limited, and we need to think of other maybe tools to use in order to properly clean our teeth. So maybe when you were younger, you were able to use a manual brush very effectively, but as you're getting older, a mechanical brush could be more helpful because it's doing some of the work for you. And if you are having some, maybe arthritis or something setting in as we do get older, that could be helpful. And also just if you're keeping your gums healthy and your teeth healthy, that is also going to impact your cardiovascular health, which is important. So they did link certain bacteria that are found in the mouth to the bacteria that can actually cause heart disease.
Okay. So you said that sometimes it could lead to some kind of heart problems, heart issues. Can you explain that a little bit?
So there's bacteria that's found in the mouth. So like people that have issues with gum disease or bone loss, that same bacteria was traced to the bacteria that can affect the heart. So people that would have maybe more predisposed having a heart attack or increased blood pressure.
Okay. So as we get older, are we supposed to make sure that we see the dentist? Is it more frequently than once a year, or is it still once a year?
Well, typically, it should be twice a year. And then if you are experiencing any issues with the gums, so if your gums look red or puffy, or if you're noticing maybe a bad taste in your mouth, then sometimes those patients are seen more often. Sometimes we see patients every 3 months or every 4 months, depending on the condition of the gum. So it is definitely a personalized plan based on the dental health of that patient.
Okay. So also when people are older, sometimes they have dentures. And
Yes.
Is that something that I'm sure that you have to care for in a different manner, correct?
Yes. So the patients do have to take care of those on their own daily to make sure they stay clean, because you don't want any bacteria or plaque film. The same way it can build up on your teeth, it can be attracted to the denture acrylic as well. So they still have to keep up with that. And when they go to see their dentist regularly, even if they have no teeth at all, it's important for the dentist that they're checking the tissues to make sure there aren't any lesions or any precancerous lesions that can be found only under the examination of a doctor or a dentist.
Oh, okay. So when you have dentures, sometimes people have them for a long period of time, but during the course of when you're growing older, sometimes your body changes. Do they have to change it, or does it stay the same? Does your mouth kind of stay the same with the dentures?
No. So over time, as someone is wearing a denture, over the years, the bone underneath can sometimes atrophy a little bit, and then the denture feels looser. And so there's a procedure called relining of a denture where we actually do another impression and they can fill in where maybe there was some bone loss to make the denture fit tighter again. So that would be another reason why it would be important for those patients, even though they might say, I have no teeth, I have dentures, right, they should still go to their dentist to have their denture checked to make sure it's fitted properly. If it's not fitted properly, they can lead to sores or ulcers in the mouth, which could be uncomfortable for the patient as well.
Okay. So if you are a son or daughter taking care of your parent or a caregiver, what are the things that you would tell them to look for in their parent or in who they're
So,
caring for?
so the best way to tell, like, if the denture is fitting properly, if you watch them while they're eating. So you would see if the denture, if the mom, the dad, or whomever, the older relative, if they say, oh, I can't eat very well, like I feel like my denture is wobbly or moving around, then that would be a sign that it's not fitting properly anymore and could be causing harm to the tissue underneath the denture. And obviously not comfortable if the patient can't eat properly. So it would be advisable for that patient then to see their dentist to have the denture, make sure it's fitted properly, and then get relined or remade depending on what the condition is.
Okay. So what if they don't have dentures and it's their own teeth? And is there something that you look for? Because sometimes, like when you brush your teeth, it bleeds. Is that something to look for? If your parents' teeth are bleeding, or any other things if they do have their own teeth, and what else could you look for?
So you could see if the caregiver or relative is able to look into the patient's mouth, like if you could have them smell really big. So if the gums look red or puffy, or they might even look like they are bleeding even with nothing touching them. Or if there's a lot of like white stuff on the teeth, that would mean that there's maybe a lot of buildup that needs to be removed professionally by a dentist versus even just at home brushing.
Okay.
And then obviously if the person is complaining of any pain in their teeth, then they should take them as well, obviously, to the dentist.
Okay. So let me ask you about certain habits like smoking. How does that affect your teeth in any way?
So yes, the smoking does affect, well, the whole mouth, obviously, and not your whole body, but just in the mouth itself, drying the tissues, it can actually cause little blood spots in the roof of the mouth and stuff, because it's almost like they're dehydrated, if that makes sense.
Okay.
So, and just the chemicals in cigarettes, I mean, even if you're doing the e-cigarettes or the vapor type cigarettes, it's still very damaging to the structures of the mouth, so the gums and the teeth.
Really? Wow, that's interesting. So are there any other possible disease or things that will happen if you do not take care of your teeth as you're aging?
So, I mean, well, if you're not going to take care of your teeth and you do suffer from some sort of periodontal disease, or if you have gum disease, something like that, you could suffer a loss of teeth. So that would be the most extreme. If you're not taking care of them, like the teeth could fall out on their own. So that would be the most thing. But obviously, short of that would be just suffering from possible pain from not getting things treated. So even if it's just that the gums are inflamed, that could be painful just from brushing and flossing, because they are inflamed until you remove all of the bacteria and stuff that's there causing the inflammation. So, and that would be helpful with just getting a cleaning done. Okay. But also, if there are cavities forming that aren't being caught because you're not going to the dentist regularly, then those can start to cause dental infections or abscesses.
Okay. So, sometimes people don't go to the dentist for different reasons. Some medical is not covered because it may be costly, or people have fear of the dentist. So is there anything that you can, like if you have fear to go to the dentist, do you give things for pain? Do you give things to, make it a little bit easier for them? Is there anything that they can ask for?
Well, typically, if someone, like, usually we'll know, a patient would call us and say, oh, I'm very anxious about seeing the dentist. And if they are very fearful, usually the first visit we can have where we just do an examination. So we're not actually going to do a cleaning or anything like that, just do an exam, discuss what maybe the condition of the teeth is, what treatment plan would be recommended, and just sort of get to know the patient and explain to them what needs to be done. And then hopefully, once they're understanding what's necessary, and, they've had a comfortable visit without any real tools in their mouth or anything going on, they'll be a little bit more comfortable and sort of just build up that confidence to be able to go back to the dentist.
Okay. So there's no, they used to give gas or laughing gas or nitrous or things like that. Do people do that anymore?
Yes. I mean, yes, that still does exist. I don't personally have the nitrous in my office, but they still do have that. Some offices, if people are getting major work done, they can give them a Valium or something to take before the procedure to sort of cut the anxiety level down a little bit.
Oh, okay. So, good hygiene, good dental hygiene. What exactly is that?
Mm-hmm.
Do you see commercials and you brush your teeth at day and in the morning and night, or how many times do you brush your teeth? What is exactly good dental hygiene?
So if you're brushing twice a day and flossing once a day, that would be technically good hygiene. Okay. But brushing your teeth, they want you to brush your teeth for 2 minutes each time. So not just a quick brush around. So like 2 minutes where you're actually, really spending time in each area of the mouth.
Oh, okay. So you have to floss though.
So there are some patients, if they're really against flossing, then we do recommend water picks. They are pretty much as effective as flossing. So, I mean, if you get something really stuck in your teeth, you're probably going to need floss. But for the most part, if someone is not flossing at all, then a water pick is going to bring them to like 95% of what a flosser would be. So.
Oh, okay. That's good to know.
Well, again, with like the older patients, if they're, a little bit of loss of dexterity and maybe being able to hold the floss, like the water pick is a very good adjunct to use instead, and they'll be able to effectively clean and keep their gums healthy with that if they can no longer floss.
Okay. That's good. So is there anything else that you would tell somebody to watch out for, or somebody to look out for, or any kind of, maybe a myth that people talk about for the dentist that you might want to dispel, or just something to encourage people to go, or anything like that?
Well, I mean, basically, like they've linked so many things to dental health now. I mean, even when women get pregnant, if they have periodontal disease, they put them on, potential having like high blood pressure during pregnancy. So there's so many different things that your dental health is linked to with your whole body. So it's very important to take care of your mouth. Like you don't think about it, but they do say one of the sayings is that your mouth is the gateway to your body. So, I mean, you could think of it that way. Everything that goes into your body is pretty much going through your mouth, right? You eat whatever foods you're eating. So being conscious of your diet is also going to impact your dental health as well. So.
Is there anything that you could, like sometimes when you go to the doctors and things like that, I mean, I know it's very expensive, but is there any way that people who can't afford or don't have coverage, is there anything that is like a program or something like that, or a place where they can at least get looked at, something like that?
Yes. So usually in most areas, there are dental schools.
Okay.
So usually the dental schools offer lower rates for dental care. It doesn't necessarily mean that you're seeing a student. Like you could be seeing someone that's actually graduated dental school already, is a full-fledged dentist or a specialist to have treatment done. Okay. And it would be at a much lower cost than going to a private practice. And I think they also sometimes do sliding scales based on income to help people out as well.
Okay, good to hear. Okay, well, thank you so much. Unless there's something else that you would like to say to share with the audience, I thank you so much for being an orthodontist here. It's very important that we know what to look out for, especially if you're a caregiver, a son or daughter is taking care of your parents or your grandparents, just to look out for, and for a senior, just to notice things that is happening to them, that they can bring it to attention so they can go and get the proper care. So that's what we like to give information that's going to help have a better quality of life as you age. So I thank you. Is there anything else you would like to say?
No, just hopefully, all of your viewers will actually, or listeners will make sure they see their dentist so that they can get a nice, complete examination and make sure everything is healthy inside there.
Okay. All right. Well, thank you, Dr. Giuliano. I appreciate your time. I appreciate you coming out, and I'm hoping that this information will help and reach some people and help people not to be so afraid of the dentist, and also just check it out just to make sure that everything is okay. So thank you so much for coming on Autumn is Here.
All right. Thank you.
Okay. Good night.
Okay. Bye.
Bye.